Hello, and welcome to Voices in Leadership from the Harvard T.H. Chan School of Public Health. I'm Eric Anderson, the director of this program, and it is my pleasure to welcome you today from wherever you happen to be in the world. Our goal with Voices in Leadership is to focus on effective leadership to create positive change in public health. Since last March, we are creating a special focus on what it takes to lead during a global pandemic, while also addressing important issues such as systemic racial reckonings and other critical public health issues. Today, we welcome Los Angeles Mayor Eric Garcetti. Los Angeles, like other major American cities, has faced unprecedented public health issues related to the COVID-19 pandemic, but also issues related to entrenched racial disparities, as well as a pernicious homelessness crisis. Today in this program, Mayor Garcetti will discuss how he's led during these times with Dr. Howard Koh, Harvard V. Feinberg Professor of the Practice of Public Health Leadership at the Harvard T.H. Chan School of Public Health and the Harvard Kennedy School, as well as Faculty Chair of the Initiative on Health and Homelessness at the Harvard T.H. Chan School of Public Health. Dr. Koh, thank you for moderating today. I turn this discussion over to you.
Thank you so much, Eric, and welcome, Mr. Mayor.
To be with you.
So we're delighted to have you with us today, and we look forward to learning more about you and your leadership regarding the public health of Los Angeles, the second largest city in the United States with a population of 4 million, and one of 88 cities in LA County, which has a total of 11 million people. So first of all, our viewers may not know that your father, Gil Garcetti, was also a public servant in LA, serving as the district attorney. And you describe your upbringing being shaped by your Hispanic, Italian, and Jewish backgrounds. Can you tell us about how your family life shaped who you are and how it prepared you to become a public servant?
Sure, Howard, and thank you so much for inviting me to be a part of this, an illustrious group of folks who came before. And it's really an amazing forum that you put together. And hello to the students and everybody else who's watching. So I grew up as a kind of middle-class kid in the San Fernando Valley. Probably the most famous suburb in the world, where Brady Bunch was filmed, where so many movies have kind of taken our hometown to the world long before maybe the world has even come there. And yeah, you know, I grew up, my father's Latino, both of his parents' first language was Spanish. My grandfather was an immigrant from Mexico. My grandmother's parents were immigrants from Mexico. My mom's side is Jewish. And to me, you know, crossing borders is kind of the history of our family and also part of the metaphor of my life, that, you know, cultural competency was about understanding. You know, I think folks thought I was Italian. We had one Italian immigrant who went through Mexico. So I was embraced by Italians, but I'd hear what people say about Latinos when they think they're not in the room, or Jews when they think they're not around. On the flip side, you know, I was at home in both cultures that were fundamentally part of who I was, understanding the Jews who fled the Russian Empire, conscription and pogroms at the early part of the 20th century. My grandfather, who literally was carried over the border in Mexico when he lost his father as a baby during the Mexican Revolution, has resonance when I watch, you know, mothers carrying their own children today over the border and being separated from them. So, you know, I grew up in this kind of middle of the universe, center of the universe, but also a very anonymous place. My father didn't become a district attorney till after I was graduated from college. So I grew up, you know, taking the public bus every single day, hanging out at the Sherman Oaks Galleria, which has been in a few movies, at the arcade, enjoying the Little League down the street, and also being aware of the importance of justice and fighting for justice everywhere around us in the world.
So that's quite a background. Thank you, Mr. Mayor. So COVID-19 has certainly put LA in the epicenter of a national pandemic. And despite LA and California being some of the first sites to institute strict public health measures last year, there have been so many challenges for your hospitals, healthcare systems, and public health systems. Can you tell us more about how you addressed all this and how you prioritized your response?
You know, we could do hours on, I think, the lessons that mayors and chief executives have learned in this, the most trying year of our life. And I hope maybe with Harvard at some point, because we're literally writing the book on how you stand up testing centers and vaccination sites, and we're writing books on kind of different aspects of leadership. But I'd summarize it in a few different ways, Howard. One is I learned that leadership is not about what you say, it's what you do. And it's really about your ability to execute on logistics. And I think when you know, somebody grows up and wants to be the president, or grows up and wants to lead a big organization or be a leader, you don't think about that. Leadership is usually the soaring speech, the vision, the people skills of hiring the right team. all of which are critical. But at the end of the day, in a kind of wartime leadership, which some have compared this to, as opposed to peacetime leadership, when it can go slower, more evolved, you really have to stumble forward. You have to make quick decisions. You have to trust your instincts. You have to pull in information as quickly as you ever have, and then execute and re-execute and re-execute until you get the logistics right. So I really think leadership is logistics. But as a mayor, I have, I used to say I have 3 C's of leadership. I have my constitutional power under our city's charter. I've got my convening power, because as you mentioned, I'm mayor of a city of 4 million, but kind of the most notable elected official, the most frequent communicator in a metro area of about 19 million people. So bringing together all my other fellow mayors of 87 other cities, our county leaders, our school district leaders is something I've practiced for the last 8 years. So that convening power is really important. And one example of that at the beginning of this is in January, I convened all of the heads of the hospitals in my office. Now, the city of Los Angeles is different than some other places. We don't have our own public health department at all. It is something that the county of Los Angeles does for all 88 cities in Los Angeles. People would say, well, what are you doing meeting with the heads of hospitals? But when I called around, I realized nobody was convening those heads of hospitals to talk about capacity, to talk about PPE, to talk about their preparation plans. And we live in such a federal system, not just politically, but when it comes to our healthcare system, that I knew it would be quite uneven. So convening power is very important. And then third is kind of coercive power. What can you do to twist people's arms and to make sure that people know, what they need to do and be the tough guy at different moments, not be scared of having enemies or people who dislike you, but really looking not to tomorrow's headlines or today's complaints, but looking 10 years back from now, did I make the right decision? And one last thing I'd say is I learned there was a 4th C, which is communication, relentless communication. And I think, I did nightly briefings on prime time on all of our channels that would be carried here for 20, 30 minutes with that critical information, whether it was emotional information to tell people to take care of themselves, to reassure them, to let them know what we're doing, whether it's material information about how to help if they're suffering hunger, housing, the basic needs, loss of jobs, or health information, which really was the most important piece for people to know so that we could collectively become leaders, not just depend on mayors, supervisors, governors to be the leaders to save us.
Tell us more how the pandemic has affected you, not just as a mayor, but also personally.
I don't know yet, Howard, is my honest answer, although I think all of us will come out of this year fundamentally changed. I've certainly carried a lot of trauma, not as much as people who have lost their loved one or loved ones, though I have, for somebody who hasn't lost a close member of the family, we lost a cousin, but I've probably had as close interactions as anybody in this country with those families that have lost people, whether it's city workers, whether it's the widow or the widower, the children, the parents of people who have fallen. That's been a part of my week, every single week. At the peak of this in January, when I was talking to 2 or 3 families a day, I think it changed me fundamentally to just understand that sometimes being there is as important as what you are working on. Expressing to people that they're not alone is a part of human health. I think it's also changed me to live a little bit more comfortably with, as I said, people who might not agree with you or not even at times like you. Because leaders, if they spend all day long, especially in a moment of social media, monitoring that, looking at that, you will just be dragged down by the emotions of people who, I studied pandemics in January as I saw this coming to us. And I looked at writings from, medieval times when the baron would be pulled from his manor home and like beheaded. People go crazy during pandemics. It is not a human emotion that likes to be told what to do. And at the same time, people dying or being very sick who you love. It is a moment of panic and chaos. And what I've learned is just to be steady, consistent, and authentic. And I think I'm fundamentally changed, though, coming out of this, like many of us, to reassess what's the next thing I want to do? How do I take the lessons of the family time, the reflective time, and try to put that into my life when a pandemic is over?
So, Mr. Mayor, through COVID, you extended paid leave benefits for Angelenos to help alleviate the economic strain that workers and families face. Is that sustainable? And what more can be done?
I absolutely believe it's sustainable. It's unsustainable not to have these sorts of things in a developed culture and society like ours. I think one of the things that this bore out, just to say it in as clear terms as possible, the World Health Organization, the WHO, said the US was the best prepared country in the world for a pandemic, and yet we executed among the worst. I think that gap isn't that we didn't have money, resources, brilliant people, hard workers. It's that we have organized policies that leave people kind of in the lurch. We're a hyper-libertarian country in many ways, and that's been even more expressed in this past year and past years politically, where we have to fundamentally ask, how will we care for one another? Not just moments when people are dying and we marvelously kind of rally around them. And I saw such acts of courage and love and solidarity in my city and around the country and the world. I chair C40 Cities, which is a group of 98 mayors around the world combating the climate emergency. And we're in frequent contact with each other. And the stories we share are just heroic beyond anything we imagine. But in general, here in America, we often kind of say, that's on you. Your homelessness is the condition of your own bad decisions, your own mental health problems, your own addiction. We look at people who are poor and don't look at racism or structural reasons why centuries have colluded to put people so far behind the starting line that they have no shot at a decent and healthy life. And so things like our paid parental time pilot program, this is 6 weeks off for all new parents, supporting thousands of our own employees. I wanted to lead by example. It was like when we raised the minimum wage in my first couple of years as mayor, we were the first big city to raise that to $15 an hour. People said the economy would crumble. We have better worker retention. We've got less sick days. We've got a positive that came out of it. And we reduced our city's business tax at the same time. So you can do things that actually are pro-business, but also pro-human, not just pro-worker. And I think when it comes to our healthcare system, that's something we need to look deeply at. A right to housing, it's something we need to look deeply at. When we look at things like a guaranteed basic income, and I'm one of the founding mayors of Mayors for a Guaranteed Income, we're looking at these pilots across America that are showing, and luckily in the American Rescue Plan, there is essentially a pilot of a basic income for people with children, a $300 payment each month instead of a tax credit at the end of the year and an increased amount. We know that these things lift people out of poverty and we all benefit from them. Hanging on to our hyper-libertarianism only costs us a lot of money.
So right now the country is focused so much on vaccination, and vaccinating a large and diverse city like LA is no small task. How is that going? Are you seeing vaccine resistance from people? And if so, how do you address that?
Well, we had a great foundation to build on. I was thinking back because it was a year from the moment that Los Angeles became the first big city in America to shut down our movie theaters and our restaurants and our places of gathering. It was March 12th. The Bay Area followed a couple days later, doing a full stay-at-home order. We worked with the governor to convince California to become the first state to do that. But we were in the first few days, and I was thinking back, about how all these things were so foreign to us. The idea of a vaccine, testing, and how the tests work. But we stood up a testing regime, again, in a city that didn't have a health department, that now we believe has tested more people than any government entity, directly tested, not just funded, directly tested more people than any government entity, local, state, or federal in the country. So we've done more than 4 million tests directly. And we stood up these mega sites as a combination of our fire department and our great health infrastructure led by CORE, a medical relief group that Ann Lee and Sean Penn, the actor Sean Penn, founded to work in places like after Katrina in New Orleans and then in Haiti. They were based right here. We thought it was a cute kind of partnership. We might do one testing center in one low-income, mostly Latino area of Los Angeles. And then it blossomed into this amazing partnership between the two. So our vaccination program is kind of caught where everybody else is. I always say there's 3 phases of this. Not enough vaccine is phase 1. Not enough capacity is phase 2. Not enough people is phase 3. And your question gets to all of them. So we stood up what was at the time the biggest vaccination site in the world at Dodger Stadium that can do about 20,000 vaccinations a day. We went to equity immediately with mobile teams, some that give vaccinations inside people's homes, others that set up in our lowest income areas, and that are doing over 95% people of color, calling people with a phone bank, texting people about appointments in certain zip codes that have been most impacted. Dr. Fauci highlighted these last week as one of the best in the country. He said, I got to tell the president about this, what you're doing in LA. So we're proud about that equity piece, but we don't have enough vaccines still. I could double the capacity today if you got me those vaccines. And I've been very outspoken with a group of 30 mayors, authored a letter to the incoming Biden administration, continue talking to my friends there about saying, give vaccines directly to cities. LA City is bigger than 23 states. LA County is bigger than 45 states, but yet we still have to go through 3 layers of bureaucracy before we get our vaccines. That seems kind of silly at this time. We'll soon go into the second phase where mathematically we're going to have so many vaccines that people aren't going to have the capacity to distribute it. I think in LA, we'll get around that because we built over 500 places that you can get vaccinated between community health clinics, the mega sites, the mobile clinics, our pharmacies, federal and state sites. It's the most in the country, and it's about 5 times the rate per capita of other big cities in America. So we're ready for when the vaccines come. We've got clinicians, we've got the method to do it. But the third one, which gets to the vaccine hesitancy, you're going to find a place when you have enough vaccines and enough capacity where you're not going to have enough people willing to. We're actually seeing some remarkably good things, Howard, where vaccine hesitancy is rapidly falling, especially in communities of color. And we've had a very determined campaign on this. Early on, when Black deaths were double the population in most American cities, represented population, we surged testing and education in those communities to put messaging out there. And Los Angeles is one of the few cities in America, maybe the only one, where Black deaths are under the represented population as a result. So after that first month, we showed the success of cultural competency. We've got a Pacific Islander community that has been very hard hit, a Native American community very hard hit. We've got Native Latinos who don't speak Spanish as their first language, but speak Native Mexican and Central American languages that we've had to learn to communicate, and they're not necessarily written languages in many cases. So for me, that last phase of vaccination stuff, it's going well, but we can't go deep enough and we can't find too many people. Lastly, I look forward to the day when either the state or the federal government, as I've asked them to, takes the handcuffs off us completely and says, vaccinate whoever you want. Because I think the one thing we missed was we did a good job with age, we did a good job with profession, we did a good job with disability, but we never did a good job with geography. And you can understand from a public health perspective, we should have gone in with surge teams, 2 zip codes that were hardest hit, and just say anybody in this zip code gets a vaccine, and we could have, I think, really prevented a lot of deaths.
So thank you so much for mentioning the concepts of equity so often when you're talking about vaccines. And right now, as you well know, the country is involved in such an important and intense dialogue about race and equity in general. And the city of LA is so diverse with respect to race and socioeconomic conditions. Tell us more about what the pandemic and your time as mayor has revealed to you about inequities in LA and the country at large.
Gosh, this could be a whole nother seminar on its own, but I'm really glad you raised this because, you know, I came to activism around human rights and ethnicity, nationalism, racism is kind of my area of my background in activism, fight as an anti-racist, to fight as somebody who understands that this isn't just something you have conversations about, you have to change systems. And I think we saw that in the racial justice marches throughout the country in the wake of George Floyd and so many other tragic deaths. But if you rewind even earlier, I remember in January and February, my first briefings, talking to folks and saying, you know, in Chinatown here, where we saw people going up to folks and telling them that it was their fault, this really started with a seed, we should remember, of planting from the highest levels in our government at the time, the president, and down, that this was somehow something Asian, and that opened a door to ugly racism towards our AAPI community, which we now see manifesting in the tragedies from Atlanta, Koreatown here in Los Angeles, where people are being attacked. Things are often being said. And there's, I think that's not going to go away when this pandemic goes away, especially as you look at, you know, history, whether it's here, I'm footsteps away from the largest lynching in American history happened here in Los Angeles. A lot of people don't know that. And it happened to Chinese residents of Los Angeles in the late 19th century. We have in Manzanar up the coast, our internment camps that during World War II, when Japan started rising, anybody who was Asian in America was attacked and called Japanese when the car companies were being threatened. And now with a US-China rivalry, I'm worried about that future, what it means for Americans of diverse backgrounds. Certainly for Latinos right now and everything that's happening with the border, and a president who really went to war against my people, saying Mexicans were murderers and rapists, although there's a few good ones in his words. I think in this pandemic, though, we realize it's not just the things people say and the vicious kind of attacks, it's the more structural things of looking at, you know, the indicators of human health and wealth. And I think if we don't connect those two together, health and wealth, we're going to be missing the lessons that this pandemic teaches us. Here in Los Angeles, we know the disparity across the country, that white families have 10 times more wealth than a Black family. Here in Los Angeles, a Mexican-American family or a Black family compared to a white family has 90 times more wealth, 90. And so when you, and if you, an AAPI community, you have to be very nuanced about, because there's different statistics depending on people's countries of origins. And you have deep poverty in lots of different communities. And if we don't look at a way to guarantee health for them and wealth building, we will be picking up the pieces from pandemics, look at homelessness. That is a pandemic that is ongoing in our country. You're more likely to die living on the street. You're basically 20 years older than your age if you're living on the streets. And that's disproportionately Black here. It is disproportionately Black across America. When we look at some of the wealth gaps, that's why guaranteed basic income, or a real conversation, excuse me, about reparations is so badly needed in this country, because it's not about just making right what was wrong. It's about materially giving people the resources to have the same shot that you may have if you're not from one of those groups. And to me, that's what this country needs to reckon with. And I think in many ways is for the first time. It's laid out that this causes people to die. And it's the numbers of this year that finally made people recognize that in my city, it's usually people of color who are driving the buses, stocking the shelves, who are going to work in the midst of people dying, putting their lives on the line so that you can eat, so that you can move, so that you can work, so that you can live. And we have to do better coming out of this, which is why I think that those more structural things, whether it's the guaranteed basic income and the way we're cutting child poverty in half, whether it's improving our public education system, or whether it's looking at ways that we can look at the mistakes of systemic racism through something like reparations, now is the time.
So, Mr. Mayor, in these times, so many mayors have been asked to address police funding issues. And you, Mr. Mayor, promised to cut $250 million from the LA Police Department budget. How did you arrive at that figure? How did you redistribute the money? And how does this spending help address racial bias, discrimination, and inequities in LA?
So we promised to actually spend $250 million at least in communities of color, 150 of which would come from the police budget, which was a fair cut that we had across many of our departments. I think if we're having an honest conversation, we need to humanize both sides of it. We need to humanize that police officers are human beings, that they should, and at their best, are guardians that reflect who we are, our values. They're amazing people who put their lives on the line. I talked with a officer who was shot in the chest here. Luckily, his ballistics saved his life the other day. We put to rest, unfortunately, a officer who got hit by a car while directing traffic 2 weeks ago. It's important to recognize these are good men and women who want to protect and do well. But culture eats individuals, and bad cultures can absolutely lead to the sort of systems that they inherit and are told to enforce that lead to the kind of oppression that we see in communities of color. We've also put too much on the backs of our police officers. And we need to reimagine public safety, something that I know people say a lot, but Los Angeles actually has experienced long before this past summer. For instance, we looked at gang crime. Remember when LA was the center of gang crime in the 80s and 90s? And we started a non-police intervention program called Gang Reduction Youth Development, which is former gang members, trauma-based treatment to families that have had generations of trauma with professionals. It's summer programs, it's youth intervention. And we're able to reduce crime by 40% more in those areas that the GRID program has been in, together with police officers. It's not either or. You need both sometimes. You're going to need an armed response when something is truly dangerous, but we don't need police officers answering every single mental health call, homelessness incident, even suicide prevention. And so we're trying to look at what we can do to relieve that off the shoulders of our police officers, and in doing so, shift some of those resources. We will be the first big city in America in the next month or two to roll out 24/7 mental health care vans that will respond to 911 calls at whatever hour. You can't blame the police officers who at 2 a.m. are the only people, or the firefighters who are the only people we call when somebody's having a mental health crisis on the streets of our cities, because we've never set up a system for there to be anything but them. And while they do get trained in mental health, and I think they do a much better job than certainly police officers did 20 years ago, that's not what they're trained for. But a mental health clinician who can prescribe medicine, who can treat a person, who can help talk them down, make sure there's no tragic outcomes there, is the right way to do this. And we've seen that in other cities. So Los Angeles will be rolling that out shortly, and I'm very excited about that. We're doing that with suicide prevention. We're doing that on homeless outreach without having an officer come when somebody says, hey, there's somebody who I feel is dangerous, and instead figure out what the problem is, try to get them into shelter and housing. Then second, though, it's not just about policing, and that's what I remind people. Putting safety first and a different model means, of course, changing all the policies. And I'm proud LA, since I've been mayor, we've seen fatal officer-involved shootings, for instance, fall now where I think we're about 95th out of 100 per capita in the country, fall by 80% just in the last 4 or 5 years. You can save lives through those things. But most African Americans who die early, it's not because at the hands of a police officer in a tragedy. It is because they have those health and wealth gaps, those education gaps that we have never addressed. So if we're serious about those investments, we need to make them. And yes, so the $250 million we put into that testing in Black communities, we put into homelessness dollars, especially focused on Black women who live in Skid Row and finding housing for them because they disproportionately face triple and quadruple traumas in their life. We're putting it into what we'll launch this coming year, the Guaranteed Basic Income pilot here that I mentioned. We're going to put it into expanding those youth intervention and prevention programs, which I've already increased by 50% since I've been mayor. So to any mayor out there, I would say, for every dollar you ever think of putting into the police department to increase that, make sure it's the right sort of model in those police departments. For instance, don't cycle your officers just for 2 years in a neighborhood. Here in LA, we have a program very successful called Community Safety Partnership. They stay for 5 years, and half of their responsibility is to walk and talk to people so they can humanize that relationship. But for every dollar you put into police department, put at least $1 or $2 into something else that will prevent crime, address racism, and make sure that we don't have to all argue about the tragedies at the tail end, but that we do something at the front end instead.
So you've mentioned homelessness several times, and certainly issues of homelessness in LA have attracted national attention. In 2018, you declared that LA can end homelessness by 2028, which was a bold and ambitious announcement. 3 years later, how confident are you in achieving that goal?
I'd never be confident, but it absolutely is something this not only city, but this nation needs to embrace. I think, we increased our budget here on homelessness, not just doubling it, not just quadrupling it, not just octupling it. It's 16 times higher than when I started. And yet we see homelessness all around us. And I've come to realize, Howard, that the solutions are not going to be just local government, though we need to build more housing, we need to hire more outreach workers, we need to do all of the things that we are doing. But until we have two things in this nation, a right to housing and a substantive mental health care system that reaches everybody at stage 1, we will continue to see unhoused Americans on our streets and in our communities. Here in LA, where the weather allows it, that's year round, unfortunately. Where tents have come and the technology and the price of those come down, that means you see it much more than in the old days when it was boxes or people in an alleyway. When I became the co-chair of Joe Biden's campaign for president over a year ago, he said, what do you want, Eric? What do you need? And I said, I don't need anything, but I'd ask you to include one thing, which is a right to housing, making, for instance, our Section 8 or housing choice vouchers a universal entitlement. And here's the logic, Howard. In this country, we say people shouldn't go hungry, and our policies reflect that. So if you qualify for food stamps, universally, everybody who qualifies for it gets food stamps. It's a universal program. We say if you don't have medical care and you're living in extreme poverty, we will not let you go without medical care. And so the Medicaid system is set up, imperfect, but still does a miraculous job of keeping our poorest treated for medicine, universal program. But when it comes to housing, probably as important as eating and as your health, right up there, tied with it, we say, no, it's a lottery. You qualify for it, but sorry, in this nation, it's a 1 in 4 chance. And by the way, that 1 in 4 will wait years to get that voucher. And in my city, it's a 1 in 8 chance. And oh, by the way, the voucher won't be enough to meet the rent of your city in more expensive cities. So you might get the voucher, but never be able to use it. Imagine a country like we see in Europe, like we saw in Japan when they ended homelessness, that guaranteed people without housing that we would house them. I know to folks who are conservative, that sounds very expensive. I can lay out how expensive it is not to do this and how much more expensive it is. I know for folks that on the left would kind of say, oh, well, don't ever move anybody off the street. I agree with them. It's not humane to do that unless there is a guarantee of housing. And then we can have an appropriate conversation about reclaiming public space in our cities, because everybody will have that right to be indoors in good housing, not just shelter, but housing. And so, that piece, together with mental health, because what we see manifested in many of people experiencing homelessness is really a mental health crisis. Howard, in my city, the folks living on the streets, a majority of them suffer from mental health and or an addiction problem. And yet we wait till stage 4. You and I in our healthcare system, we break our feet, both of us will go to the emergency room and see a doctor. But if you and I have an addiction, neither of us will be seen today by anybody, and not probably for a long time. So I think those are the two things we need to really elevate up while we're fighting this fight at the ground level here. And LA passed the largest housing bond on homelessness in history. We'll get 10,000 new units of housing out of it, a sales tax at the county level for services. We have a governor who's doubled and tripled down on helping us buy hotels and motels and apartment buildings. And the federal government's now copying that, which is great to see. We're doing all of those things right, and we need to do them more. But this is about money, and it's about those two rights, to mental health care treatment and to housing.
So thank you for those comments, Mr. Mayor. We have a new initiative on health and homelessness at our school, so your comments are very important to us. And so related to all this, in your State of the City speech in 2018, you declared that homelessness is the greatest moral and humanitarian crisis of our time. But then COVID-19 hit, and also protests over racial injustice. So how did you tackle all these enormously challenging public health crises at the same time?
You don't have a choice when you're mayor. You got to wake up and do all of it. It's like the one-man band, although I'm certainly not a one-man band. I'm in the whole administration, all my city workers, everybody else. We're kind of playing the drums while hitting the cymbals and harmonicas in front of us. You have to do all of them. And to the truth be told, it's really one instrument, Howard. These are reflections of the same thing: inequity. Health inequity, racial inequity, housing inequity, all tie together. They have prisms through which you can look at these problems, whether racism, whether it's sexism in this country, because so many, 80, 90% of the women who are unhoused are the survivors of either sexual and or domestic violence. When you tie these things together, you start to understand how the solutions are also tied together. And so, for instance, early on, it was, you probably remember this, it was conventional wisdom that people who were unhoused would be hardest hit by COVID. In Los Angeles, we surged a lot of public health workers to do checkups, to pass out PPE, walk up on no appointment testing in places where there were encampments. And I'm proud, just as I was mentioning the statistics for African-American deaths being lower than the African-American population percentage. Here, you're less likely to have gotten COVID if you're unhoused than if you're housed. Now, some of that probably we learned over time, tighter spaces versus living outdoors, but we have a lot of people who are living in congregate shelters as well. And we did that through a combination of what I like to think is probably government at its best. The federal government, even under the previous administration and this one, allowing us to put people, I've been calling for years for a FEMA level response to homelessness. And what I meant was, can't we do something about it before they die, before they're hit with the floods, the disasters that people have on the streets? For the first time under the Trump administration, so credit where credit's due, FEMA allowed us to put people into hotels and motels. And at that time, they paid for 75%. Biden administration has now made it 100%. So we could take people off the streets and protect them. We could give them the healthcare checkups that they needed. We could feed them. We could see, in this country, we saw poverty cut in the first few months of the worst economic downturn because of the income that was sent to American families. So these things are absolutely possible. We actually, on top of the 20,000 or so people that we probably helped get out of homelessness this past year, we had another 8,000 folks that we were able to touch with housing solutions and shelter because of these federal, state, and local programs working together. We're the soldiers who do the work. The state was helping us fund some of it and through the federal infusion of cash. And that allowed us to today still be able to do that. And my request to the federal government is don't cut us off when we all go to green. Give us another 6 months or 9 months, because there isn't an apartment always just waiting for everybody who's in one of those hotel rooms. Give us time to make this a success for every single one of those people, so we don't abandon them to terrible public health, which is the condition of just being homeless after this pandemic is over.
So, Mr. Mayor, brighter days are finally ahead as vaccines are being rolled out and our schools and our economy reopens. But so many issues still need your attention. In addition to the inequity theme, what has this pandemic and all these challenges taught you about lessons that are transferable to addressing societal issues in all cities across the country?
Wow, I mean, it teaches lessons. I've kind of looked at this. I don't have a lot of time to reflect in a year like this because I can't remember a day that I've taken off in the last year. But I think that for all of us, we're sick and tired of dancing around the edges, and we want much more structural change. And you saw that in the American Rescue Plan, and I hope we'll see it in the infrastructure package coming out of Washington later this year, which I'm very optimistic about. I think American exceptionalism, we see both sides of it now. How beautiful and wonderful it is, and how tragic and horrible it can be when we think we're better and don't do some of the basics that other countries. When West Africa has a better public health care system when it comes to contact tracing and community workers than we do. I hope that we stand up some permanent things out of this. I hope we never again defund and disregard public health, which happened systematically, throughout America for the last couple decades. I hope we realize our potential. And what I'm scared the most about, Howard, not just for my city, but for America, is that we'll lose our optimism and that we'll lose our can-do spirit. We can't be down on each other. And I think the greatest hope I have is actually not a policy prescription. It is that we'll find one another again. We're becoming so polarized. I was reading an article yesterday that we're even living with people who just think like us and look like us more than ever before. We might not be segregating as much racially as America once did, but we're segregating ideologically. And when de Tocqueville came through America, the thing he said that set us apart is that in practice, we practiced democracy in a real way, not just the kind of superficial way that social media reinforces finding your tribe and people who think like you and fighting vehemently with the people who don't, but hanging out with people of diverse opinions and working it out, forming associations that are face-to-face and not virtual. That is the challenge for America. If we can find each other, democracy is a greater strength than any other system in the world. It really is. But if it's just freedom with no responsibility, hyper-libertarianism without a sense of, look at Israel. Israel has married socialistic and socialist kind of philosophy of the founding of that country, that we will all look after each other. We are one nation, with the creativity of the free market. And, I'm sure somebody will use this clip years from now against me. He said socialist, or somebody else saying free market. Oh, that's terrible. He's just like, let people go. There are wonderful things to find in multiple systems. We've locked into our own hate. We've locked into our own opposition. We've locked into what we dislike. We've locked into who we are supposed to be against rather than what we share. And if COVID's taught us one thing, we have to find, ironically, a crisis that demanded that we be separated from each other, we found out could only be solved by coming together. And I hope that lesson stays with us way past this year.
Thank you. Final question for you, Mr. Mayor. Students at the Harvard T.H. Chan School of Public Health are committed to making the world healthier, more just, and happier. What advice do you have for these emerging leaders in terms of how they can best serve the public interest?
Well, don't wait to be told you're a leader. You're a leader today. It is young people who have always led social change. I would say stay fearless. Don't let anybody tell you can't do anything you set your mind to, but stay humble. Don't let that fearlessness make you think you're the center of the world. No, admit where you failed. Listen to other people. So be fearless, be humble. The third thing, though, is don't learn just how to speak. And I know I'm not modeling it particularly well in this, but learn how to listen. I always think that's the most important thing. And when I was in the classroom as a teacher, I used to always be very grateful for those students in the front row. When you ask your first question the first day, raise their hands and give you an answer. Without that, you'd have silence. But I was also struck by how 2 or 3 or 4 classes later, there would be somebody in the back of the class who would raise her hand usually. Everybody would turn around because they forgot she was even there, and would give an answer so deep and so insightful, it changed everyone, including my own thinking. Because that was a person who spent the first few classes listening, hearing, thinking. So be fearless, be humble, but listen. And then the last thing, and I think it's baked into what you said is the school's motto, is lead with love. Just because you have the skills to be strong, you have the humility to realize that you have to do this with others, and you're a good listener who can kind of process information. That means nothing if you don't lead with a certain morality. Lead with that love against somebody who's different from you, somebody who's yelling at you, somebody who says, yeah, let's go burn the place down. Because at the end, it is important to have these moments of disruption. Certainly not a pandemic, it's not important to have it, but we had to suffer through that. But whether it's the racial protests of this past year, whether it's the uncomfortable moments, those are necessary, but they're not a destination. if we don't know how to cross the street and come in from the picket line to sit down, to take the levers of government, which reflect us in a democracy, to not say our leaders are them, to not distrust every institution. We look at polls now, whether it's business, whether it's obviously now, public safety, certainly government, media, the banks, religions, everybody distrusts Americans distrust all these institutions. Well, go change the institution instead of being mad at the institution. Be the institution. Institutions reflect who we are. And whether you're a person of faith like I am or just a deep humanist, if you live in a democracy and you believe in the innate kind of divinity of human beings, democracy should reflect that. And if it's not, make that happen. And so my advice to every student is just put your head down, work hard, fail forward. Like I said, learn logistics. Don't just have great opinions, learn how to actually do things. And take those 4 things of strength and humility, of fearlessness, humility, learning to listen, and leading with love.
Thank you so much, Mayor Garcetti. We've certainly listened closely to you today. Thank you for sharing your thoughts and your time with our audience. And we've learned a lot about you, your city, and your leadership. And we wish you all the best as you continue to work on behalf of the people of LA and our country.
Thank you, Howard. Sending you all strength and love. Hope is on the horizon.
Thank you. So we will be bringing you more Voices in Leadership during Crises segments in the weeks ahead. Stay tuned, and thank you so much for joining us today.